on that one. Number two, give doctors economic incentives to listen to their patients. Again, we've talked about this in a few different vignettes throughout this series of video clips. You know, there's the old saying that an ounce of prevention is worth a pound of cure. And when we start talking about medicine and health, we may say that a dollar of prevention is worth $100 of cure. And that's just recognizing the economic and other realities, that it is a lot cheaper and a lot better in every respect to intervene in the case of a patient maybe who's inching toward type 2 diabetes, and to talk about issues of diet and exercise and nutrition and wellness and lifestyle and all the things that can help that person, that patient, flourish and not walk down a path that will lead to just a lot of trouble, a lot of frustration, and a lot of medical bills. And so we've got to make sure that our doctors, and especially our primary care doctors, are given the encouragement and the financial encouragement. It's a big part of it to sit down and talk with folks. We've got to make sure that those primary care doctors and other folks, nurse practitioners, community pharmacists, other folks who are actually face-to-face with patients, are compensated for the thing that ultimately will save our country and individuals tons and tons of money, and will ultimately make us a healthier country. So that's that one. The next one is transition away from an employer-based coverage model to an individual-based portable coverage model. And what this is, what I'm arguing here is that we've got to adapt our health insurance coverage to the times that we live in. Now, we happen to live in a time when it is less common than as recently as maybe 30 years ago or less than that. Folks who are graduating college today may work for 5 or 10 different companies over the course of their career. Now, that wasn't the case, you know, for the folks who came back from World War II, and they likely worked for the same company or maybe 2 companies if they were, you know, if they were pretty maverick about it, over the course of a 30, 40, 50-year career. And the reality now is we've got folks working in the tech sector and any number of places. We're simply more mobile as a society too. And there are gaps and inconsistencies in the coverage whenever we say that you have to work for some big company, if it's Exxon, or if it's the big hospital in your town, or whatever else. And if I take a job with another company or a small business or something else, then what goes into my calculus, my personal calculus of whether or not I can take that job is, will they have insurance coverage? Will it be as good as the coverage that I have right now? And here's kind of the compelling, I think, side to this particular argument, and that's the system as it's set up now encourages people to work for big companies that provide the best benefits. But in a time like we live in today, a lot of those big companies simply aren't hiring. And maybe they've even shed jobs over the last few years. And we want to encourage, and our economy needs us to encourage more people to strike out and start a business or to join a small business and to make things happen economically in your community. And the system for healthcare coverage right now is set up to discourage people from doing that, from doing the very thing that we're arguing about and even encouraging folks to do from Washington and all around the country, which is, hey, we've got to create jobs. And so in order for us, I think, to take a step forward economically, we've got to move away from this employer-based model, because it's not in step with the times, and it also discourages one of the fundamental activities that's made America great, which is entrepreneurship. And now again, imagine if we took that onus and that burden off of a small business and said, look, we're going to find an alternative way to provide that coverage. There's no logical tie between your print shop or your deli sandwich shop and the health of your employees. We're going to allow you to reinvest that money in salaries, in facilities, in expanding your business. Imagine the economic stimulus that would come from the small and medium-sized businesses around America not having to subsidize the health coverage of their employees. Now, that's again, it's not as radical a proposition as it may sound, because it's really consistent with with I think the ethic that America's built on, and B, we don't have to rush off and do any of this stuff wholesale or immediately. We can gradually phase in a model that recognizes individual accountability, individual ownership, and also finds alternative ways to fund and to kind of stand in the gap of the subsidy that currently comes from employers. But again, I think it's a direction that we need to head. It's one that makes a whole lot of sense if you really take some time to think about it.